Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute pancreatitis, and we're looking at the Ranson prognostic scores. So first we look at the Ranson prognostic scores at presentation. So when you look at presentation, there are two categories, that is non-gallstone pancreatitis and gallstone pancreatitis. So now let's look at the non-gallstone NGS, non-gallstone pancreatitis. So here in terms of non-gallstone pancreatitis, the age is greater than 55 years and the blood glucose level is greater than 200 mg per dl. Next is, what is a WBC? The WBC is greater than 16,000. So it is greater than 16,000 cells per mm cube. And when you look at the serum LDH level, so serum LDH level is going to be greater than 350 IU per L, and the serum aspartate aminotransferase level. So the serum aspartate aminotransferase level, this is going to be greater than 250 IU per L. So these are the values. Now the same thing with respect to the gallstone pancreatitis. So here in terms of the gallstone pancreatitis, so what do we have here? We have the age. The age will be greater than 70, and the blood glucose, it will be greater than 220 mg per dl. Then there is also the WBC. The WBC is going to be greater than 800, whereas in non-gallstone it was 16,000. Here it is greater than 18,000. 18,000 cells per mm cube. Next, when you look at the serum LDL, the serum LDL level is going to be greater than 400 IU per L. Lastly, we have the serum aspartate. The serum aspartate aminotransferase level. So this will be nothing but greater than 250 IU per L. Next, we move on to the Ranson criteria, and this will be after 48 hours. This is greater than, that is after 48 hours of the admission. So in this case, let's look at the parameters. First is the NGS, that is a non-gallstone pancreatitis. So in terms of the hematocrit cells, hematocrit. So here in terms of the hematocrit cell, hematocrit fall. So in the hematocrit fall, it is greater than 10%. Next, in terms of the serum calcium level, it will be less than 8 mg per dl. The base deficit is going to be greater than 4 MEq per liter. And looking at the BUN, that is a blood urea nitrogen level, it increases by, there is a greater than equal to 5 mg per dl despite the IV fluid hydration. Next, we move on to the fluid sequestration. So there is fluid sequestration, and this is nothing but greater than 6 liters. Then looking at the PaO2, this level will be less than 60 mmHg. Now let's look at the gallstone pancreatitis. So gallstone pancreatitis, the hematocrit fall will be greater than this will be greater than 10%, and the serum calcium level this is going to be less than 8 mg per dl. Then the base deficit. The base deficit is going to be greater than 5 milliequivalents per liter, whereas in non-gallstone it was greater than 4 milliequivalents per liter. Next is the blood urea nitrogen level. It increases, that is, it is greater than 2 mg per dl, and this will be despite the IV fluid hydration. What is the IV fluid hydration? Then let's look at the fluid sequestration. This will be greater than 4 liters, and looking at the PaO2, it is unavailable. Next, let's move on to the Ranson score. So here in the Ranson score, it means that greater than 3, it's acute severe pancreatitis. And looking at the score interpretation, this will include 0 to 2 points. So there is 0 to 2 points. So this includes about 0 to 3% mortality. Then when you look at 3 to 4 points, this will include 15% of the mortality. Then when you look at 5 to 6, this will be about 40% mortality. And 7 to 11, it is nearly 100% of the mortality. To learn and grow daily like this, please do subscribe.